So we must dispense with this delusion that somehow there's a significant difference between the Tory party and the Labour Party when it comes to the NHS. There isn't. There has been a continuous policy stream since the late 1980s, which Tony Blair did nothing to reverse. In fact, he embedded it even further. The 13 years of the Blair Brown administration saddled the NHS with private finance initiative debt, hemorrhaging money servicing these toxic loans to build new hospitals. They embedded the market bureaucracy, which is also draining upwards of 20% of the total NHS budget in management and bureaucracy. And what they also did was set about, for the first time in NHS history, outsourcing clinical services. This had never been done before. Alan Milburn, the health secretary under the Blair administration, justified this as, our friends in the private sector just giving us a temporary hand. Well, that was a lie. They've become embedded. This has grown under the Conservative administration. And now who do we have to trust? Starmer, who has been endorsed by BlackRock's CEO, Larry Fink, as a safe pair of hands for his investments. And we have Wes Streeting, who doesn't want to settle the doctors' dispute, hasn't got a single critique of the policy decisions that I've just outlined to you, some of which are blatantly privatizing. And in fact, he's doubling down on the Milburn deal. He says our friends in the private sector will help us deal with the waiting list that has been created. So there is no chance that this Labour Party under this leadership will be doing anything different. In fact, it's probably more dangerous, because people who are still believing in the lies that are coming out of the Labour Party may actually step back and expect things to improve, when actually they should be fighting tooth and nail against the betrayal of the public interest. This is not necessarily an issue of funding, because money is being diverted away from patient care. It's going to PFI servicing debt, it's going to market bureaucracy, and it's going to the medico legal bill, which you mentioned earlier. So money and profits, of course. So money is being leached out of the system. And if we just simply throw more money into a system that has been totally repurposed into a corporate cash cow, well, expect the profits and dividends to go up. Don't expect care to improve. So there's something which hinders us from pushing back. Human nature is such that if things happen gradually, we start to accept them. They become normalized. So, with the outsourcing of medical services back in the early 2000s, now it's become normalized. We accept it now. We accept seeing outsourcing contractors providing cleaning, catering, and all the other services within hospitals. Nobody bats an eyelid when there are multiple logos on the side of an ambulance. So we end up getting used to things getting worse. We are already seeing patients, I think we're the worst in Europe for patients having to pay out of pocket for operations and treatments because they're languishing on NHS waiting lists. So it's already happening. The problem is the public feel helpless, feel that there aren't any real political options, and rather than fighting collectively for the right thing, are always looking for maybe a way out that they've got control over, which is taking care of their own self by maybe taking out top-up insurance.